Hi everyone, my name's Tom. I'm one of the physiotherapists over at TPL, and I wanted to talk to you today about what to expect post-operatively, particularly orthopaedic surgery, so anything that requires you to have a surgical intervention from a consultant. This is something that I can relate to. I most recently had a hernia repair, so a groin repair, so this is kind of thing I've been through quite recently myself too. So the first thing to expect, and probably the most obvious thing to expect, is pain. So there's a reason you went to see a consultant in the first place, and that's likely because you had a structural pathology that's been causing you pain. So that's one reason why you might get some pain. The second thing is surgery in itself is trauma. So when you have an operation, the surgeon has to cut through the skin, has to cut through soft tissues. In certain circumstances, they might have to drill through bone or take a graft site from somewhere else. So pain is normal, and it's very important that you stay on top of your pain, particularly for the first few days, the first week or so. Follow the guidance that's been given to you by the discharge team in the hospital around pain relief and movement, particularly sort of what the physios might have given you on the ward to help with sort of basic pain management strategies as well. Just so that those first few days are as comfortable as possible when you get discharged. That might have been a day case, or you might be in the hospital for a few days. So another key thing to consider is infection. Unfortunately, one of the complications for any surgical intervention, small or large, is infection risk, purely because during the operation you have to be cut open, to be frank. So for the first few weeks, it's really important that you try and keep the wound clean. You may well have been given dressings or cleaning materials to help with that. There certainly have been given some guidance around what to do with regards to showering and bathing, just to try and minimise the germs that get in and around that wound. Unfortunately, the complications of infections can be quite serious in some cases, so keeping on top of that is really important. The key things to look out for with regards to that are sort of obvious redness, heat and weeping around the wound, sort of systemic feelings of infection, or feeling fatigued or fever or temperature, those sorts of things. And if you are experiencing those things, you can contact the hospital where you had the surgery. The ward staff might speak to you, or also an option is speaking to your GP. If it is more serious than that, when it seems a little bit more imminent, then you can also call 111 or 999 as well. Vast majority of people do not have issues, but it's just something to consider early on. So another consideration post-surgically is our risk of blood clotting, or a DVT. Now they can occur either in the leg or in the arm. Now again, the vast majority of people do not suffer with this. Unfortunately, it is just a risk factor that we need to be aware of if we've had surgery. So the signs and symptoms to look out for with this are cough, redness, swelling, tenderness, or in the arm as well. And sometimes we can see some more superficial blood vessels compared to normal. And it can also lead to things like shortness of breath, so real difficulty trying to get your breath whilst talking. Normally, when these get picked up, they're very effectively managed, so often nothing to worry about, but something to just keep an eye on for the first few weeks. You may well also be given things like stockings at night to wear on your legs to reduce that risk even further. So the next thing is your mobility and your walking. Now, post-operatively, as we've mentioned, you're going to have pain, so this isn't something that you're just going to get back to straight away. But more often than not, we try and encourage trying to get back to normal as quick as possible. Now, certain people, depending on what type of surgery you've had for what pathology, will have specific restrictions based on their weight-bearing status. So, for example, they might be non-weight-bearing for a certain amount of time on elbow crutches, or they might be partial weight-bearing on elbow crutches, they might have a boot on. But for a lot of us, we'll be allowed to fully weight bear early on, so don't be surprised if the physiotherapists on the ward come round and get you out of bed early on. Now, the reason why this happens is we want to try and mitigate the secondary effects of surgery as much as we can. So, for example, we want to maintain muscle strength, we want to maintain range of motion, we want to try and reduce swelling. So there's lots of reasons why that happens, and ultimately trying to regain that independence around the house as early as possible will enhance your recovery. The final thing is your rehabilitation. So once we've got the pain settled down, once you're up on your feet and mobilising, I would strongly recommend seeking the guidance of a physiotherapist or someone who's qualified in post-operative injury management to ensure that we get you back to where you want to be, whether that's a return to work, whether that's a return to sport, in the safest and most effective way possible. Now, what this entails more often than not is some hard work, some strengthening exercises, some range of motion exercises, some hands-on manual therapy to get you feeling better and get you moving better. And depending on what type of surgery you've had will depend on how long that rehabilitation process takes. And having that step-by-step guidance and that reassurance along the way is vital in making sure that we get you back to your baseline and back to doing what you want to do.